complexity of pain and the complexity of medications and the risk of medications, what we really need is a cultural shift for people to learn to tolerate a little bit, manage their risk tolerance for pain, to hear what the body's telling them.
Right. I would agree with that. We need to show people that pain, some degree of pain is acceptable and appropriate, but certainly pain that causes undue distress is certainly to be treated. So it's a cultural thing that we all have to be aware of.
Let me ask a wacky thing from the outside. What about the emotional aspects of pain and where the mind-body connection? Where are we in pain because we are physically not working, or they've done a lot of studies where if you have emotional issues, your pain tolerance goes down, or you may have, I'll call it phantom pain.
Right. Well, there certainly are links between depression and anxiety and the perception of pain, and this is nowhere more pronounced than in fibromyalgia, where for some unknown reason the central nervous system of people leads to this constellation of symptoms with muscular pain, joint pain, anxiety, depression, and so that's a perfect example where the mind-body connection has somehow gone awry and caused people to have chronic pain. By the way, there's a new test that they have with MRI that's finally been able to diagnose patients with fibromyalgia with a reasonable degree of certainty, where they would stimulate the patient with a pain stimulus under MRI and see changes that are occurring in the brain. That's a new technology that's come out.
Well, that's good, because there are those that say that people with fibromyalgia, it's all in their head.
Right. Exactly. And really it's in their brain.
Or did they just retrain their brain?
Right. Well, so the point about the mind-body connection is very important.
All right, but back to, so in the end, pain, as always, we're watching our bodies. We're understanding and respecting our bodies.
Yes.
Treating it judiciously.
Right.
But also seeing what we can tolerate.
Yes, I think it's important, especially with regard to post-surgical pain, and trying to avoid taking opiates if you can.
All right. Thank you, David.
Okay.